Yeah, so I think to start off, one of the important things to talk about is kind of what is standard of care right now for patients with IDH1 mutations. So IDH mutations are present in about 20% of people with newly diagnosed AML, tend to be a slightly older range of patients. So I mentioned that as well. The median age is around 70. And about 7 to 8% of that are IDH1, 12 to 15% or so are IDH2. There are two standard of care regimens right now for patients that have IDH mutations. So the VIALE-A trial established azacitidine in combination with venetoclax as an option for both IDH1 and IDH2. For patients with IDH1 mutations, this leads to about a median overall survival of about 10 months, so just under a year. And about two-thirds of patients will achieve a remission with that regimen. For IDH2 patients, they do a little bit better with just the HMA and the venetoclax. About a 2-year overall survival, maybe three-quarters of patients will achieve a remission initially. And then for our patients with IDH1 mutations, the other standard of care regimen was established by the Agile trial, which combined both azacitidine and ivosidenib. This resulted in about 50% of patients achieving remission and about a 2.5-year overall survival. And so that is kind of currently what the options are available for people. If you notice, these outcomes are not terrible, but they're still not universal. There's still a significant amount of patients who are not responding. And kind of the curves of these tail, there doesn't seem to be a lot of people that are being cured by these regimens. And so what we were really excited about is combining all of these active agents together. What happens if we combine a hypomethylating agent, venetoclax, and an IDH inhibitor to see if that can deepen remissions, extend overall survival, to have more patients responding to these therapies. And so I think some of these new novel combinations are really exciting. And in particular, when we look at hypomethylating agents, we have azacitidine, which is sub-Q or IV. We also have decitabine, that's IV, but there's also an oral formulation of decitabine, the decitabine cedurazidine. And this has been shown to have an equivalent area under the curve and exposure to IV decitabine. And so this opens up the really exciting concept for patients of potentially having an all-oral combination regimen for their treatment.